The government is tonight cautioning Kenyans who are seeking coronavirus testing services at Lancet Kenya. This after a series of contradictory results. Health Cabinet Secretary Mutahi Kagwe, while acknowledging repeat cases of differing COVID-19 results after tests conducted by Lancet, said that there was an ongoing investigation by the Kenya Medical Board which could lead to the closure of laboratories that do not adhere to testing protocols. With the rising number of COVID-19 cases countrywide, just how many Kenyans have tested positive, yet they were actually negative? Francis Gachuri reports on the confusing results.
Lancet Kenya, a leading private pathology laboratory, is yet again in the eye of a storm, with questions emerging on the authenticity of some coronavirus tests it has conducted. The latest case involving teachers at the prestigious St. Andrew's Tourist School in Molo, Nakuru County. 17 staff members were declared COVID-19 positive after tests by Lancet Kenya, but were found to be negative 3 days later when similar samples were tested by the government agency, Kenya Medical Research Institute, KEMRI.
It is true that there is one lab, specifically Lancet, which is the one that carried out these tests that you are talking about, that eventually turned out negative, from positive to negative. I think it is also the same lab that had also tested another group of people in Nairobi, which also had the same circumstance. The same thing was noticed. So it is not the first time.
Last month, Kiambu town lawmaker Jude Njomo and his family were forced to bury their 82-year-old mother at 8 p.m. in compliance with government protocol for interment of COVID-19 patients who succumbed. Lancet had returned the positive result on samples taken from the career teacher, but a day after her night burial, results from Nairobi Hospital declared Njomo's mother coronavirus-free posthumously.
How many other Kenyans have gotten wrong results because maybe a laboratory was careless? There are many other Kenyans who are voiceless.
You can have the same sample tested on 3 different machines and they give different results, some even giving negative. This is unfortunately part of the science limitation. And what I'm saying is, we've actually discussed this as a ministry or as a country. What should be done with those samples that have a low viral load?
The government cautioning Kenyans seeking coronavirus testing services at Lancet Kenya. The laboratory charges between 8,000 shillings and 11,000 shillings per test.
If you've been hearing that a lab has got all these unclear results, don't go there. Usiende huko. Why are you going for a test that you know, to a lab that you know has been giving information that may not be clear?
A report by the Medical Practitioners and Dentists Council, dated 29th June 2020, addressed to the Health Cabinet Secretary, gave Lancet Kenya a clean bill of health. But on the issue of discordant results, the Council's inspection team was unable to make a full determination without full information on the patient's clinical history, sample types collected, date and time of samples collection, as well as information on the test equipment, reagents, and methodologies from laboratories that reported discordant results from Lancets. With the COVID-19 free certificate increasingly becoming a much sought-after document for hoteliers and truck drivers, and soon for travelers when international flights resume, accuracy of the test results remains the ultimate issue.
I understand that as a government, as a Ministry of Health, we have a responsibility to ensure that the laboratories that we are licensing are those that are carrying out and working in a believable manner. And it is so important for us to keep people informed in such a manner that is true. Because the worst thing that we can do is have a situation where people question the results that we give.
126 days since the first COVID-19 case was reported in Kenya, the number of confirmed cases has risen to 11,673. But just how many of these positive cases are actually negative?
And where we believe that a laboratory is not performing in accordance to the rules, not adhering to the standards, then definitely we will close them down.
Francis Gachuri, Citizen TV.